Continuing the series of general surgery topics, next is the esophagus. Coming to the surgical anatomy of esophagus, it is a muscular tube that starts from the level of C6, and through its course it is having constrictions at three different parts: 15 centimeter, 25 centimeter, and 40 centimeters. All those measurements are taken from the incisor tape. Okay, 15 centimeter mean there is cricopharyngeal constrictions. 25 centimeter में aortic and bronchial constriction, and at 40 centimeter diaphragmatic and sphincter constriction. Come to the diaphragmatic opening. You can remember this with the mnemonic: I ate 10 eggs at 12. Okay, so I for IVC, 8 means T8. This is T10. E for esophagus, and G for, you can remember at vagus, and other G for gastric artery. And 12 means T12, that is the abdominal aorta and thoracic duct. Okay, there are three types of peristalsis: primary, secondary, and tertiary. Primary and secondary both are propulsive. Propulsive means it pushes the foot downwards, and these occurs when you are taking meal. In aged patient, old patient, there's something called a tertiary peristalsis. This occurs between meals, and it is non-propulsive. Okay, the esophagus as such, it lacks serosa, and the strongest layer of esophagus is the submucosa. Okay, coming to the segmental blood supply. Now you can divide the esophagus into upper, middle, and lower esophagus. The upper part, it takes the blood supply from the inferior thyroid artery. The middle part, it takes from the bronchial arteries, and the lower part, it takes blood supply from the left gastric artery. Coming to the venous drainage, upper part same to the inferior thyroid vein. The middle part goes to the azygous venous system, and lower part to the left gastric veins. Okay, now Mallory Weiss tear. What is Mallory Weiss tear? There is a tear in the lower part of esophagus, and they ask you what is the artery involved in it. So we all know that the lower part of esophagus is supplied by the left gastric artery. So the artery that is involved in Mallory Weiss tear is the left gastric artery. The lymphatic drainage are present in the submucosal space, and because it is a longitudinal spread, there can be skip metastasis. What is the clinical important in this? If suppose this is the esophagus and this is the site of adenocarcinoma, there can be metastasis with a distance, with a normal part in between. Hence, when we do a esophagectomy, we need to keep a high level margins. We're going to discuss this in the section of adenocarcinoma. One more thing, in the previous slide, I told you that the esophagus originates at the level of C6, and आप पूरा GIT को देखेंगे तो C6 सबसे पतला, it is the narrowest part. Okay, it is the narrowest part. So if anything is dislodged like beyond C6, it can't be removed easily. It has to be removed with an endoscope only. Okay, coming to the sphincters of esophagus. There are two sphincters at the level of upper esophagus and at the level of lower esophagus. Upper esophagus में it is anatomic plus physiological. Lower esophagus में there is only physiological. What is the difference between anatomic and physiological? Physiological मतलब वहाँ पे आपका pressure will be more. There will be only high pressure in that area. If you combine that with anatomical मतलब there is actual constriction. Actual constriction is there with high pressure. That makes anatomical with physiological. And lower esophageal, there is no actual anatomical constriction. There is only a physiological sphincter. The normal pressure is 8 to 25 mm of Hg. And there are two things. If it relaxes frequently, it can give rise to GRD, and if it doesn't relax, it can lead to eclasia cardia. Okay, and the upper esophageal sphincter is formed by the inferior constrictor muscle. Now there are two parts of the inferior constrictor muscle. One is the thyropharyngeus, and the other is the cricopharyngeus. And there is a gap in between, from which if there is dehiscence, we call it Zenker's dehiscence. Okay, so this will complete all the important surgical anatomy of the esophagus. Next, we're going to look into the pathologies of esophagus.